Again, and this is our last video for tonight. In this video I will focus on upper and lower extremities. Let's begin with upper extremities that include the skin and nails. Throughout the whole assessment, from the beginning to the end, I've been observing and inspecting the skin. I'm continuing to inspecting the skin in the upper extremities. It looks nice and warm. There's no lesions or bumps or any deformities. The nails, let's inspect the nails. The capillary refill is brisk, it's less than 3 seconds. Next, we'll be evaluating the lymph nodes, and in particular the epitrochlear lymph node that is located on the medial surface of the arm above the elbow. This is the lymph node. Next, let's evaluate and assess the pulses. Strong pulses usually get the number 2+, and let's begin with the brachial pulse. It is located in the upper arm into the antecubital fossa of the elbow. Right here. And the other one is the radial, which is at the wrist. It is found at the wrist. And when we do this assessment of the upper extremities, we would like to compare the pulses for strength in comparison for the symmetry. Next, we'll do the joints and their associated range of motion. Let's perform pronation of the wrist joints, pronation with the palms up, and supination. Oh, pardon me, pronation is the palms down and supination is the palms up. Again, we are evaluating the range of motion, and I'm noticing if the patient can extend the joints as far back as possible according to the movement required, and also checking for comparison. Let's inspect the coordination. The coordination assessment allows us for smoothness and accuracy detection. The test for coordination, one of the tests for coordination is a rapid alternating movement. So we would like to pat the knees with both hands, then raise your hands, turn them over, and then pat the knees again. Subsequently, the patient should be asked to continue in a faster fashion, do the same exercise but faster. Another coordination test is finger to nose. Take your pointer, meet my finger, and then touch your nose. And then do the same with the other hand. Touch your pointer and then touch with your nose. Perfect. And we're checking for symmetry again, and coordination and balance. The sensory system of the upper extremity includes sensation to light touch or pain, and we're comparing the left and the right sides. Do you feel any sensation to light touch? And do you feel pain?
No.
Well, I'm not going to squeeze you very hard, but do you feel on both sides? Okay. Usually, if there is any deviations, the patient may report only pain to one extremity versus the other. Continue with the assessment is discriminative sensations, which is the reflexes. I'm going to use my reflex hammer, and let's do the bicep reflex. I'm supporting the arm of the elbow, and I'm striking a blow, open your arm, with my thumb. So this is the reflex that is being elicited. And the next reflex is the tricep reflex. which is I'm allowing the arm to dangle, and I am eliciting the reflex, and then on this side as well. Well, your arm has to be dangling. Perfect. Thank you, patient. Then we will continue the assessment with the lower extremities. Again, I am doing evaluation of the skin and the nails of the lower extremity. I'm checking for the capillary refill, for moisture, for any deformities, for any lesions. Let's continue with the lymph nodes associated with the lower extremities, and this is the inguinal, or in the groin. The lymph nodes should be in the groin, near the inguinal, or near the femoral pulses. Let's find the posterior tibial pulse, which is located in the back of the neck, midline, in the calf muscle. So here is usually where the pulse is located, a little bit below the knee, below the popliteal. This is how, right there approximately. The next reflex that is required to be examined is the dorsalis pedis. It's found following the anterior of the tibia down the leg on the dorsum of the foot. Usually in clinical, we follow like an imaginary line between the first and the second toe. Next is let's check the joints and the range of motion of the ankle, and let's do a few exercises which are to assess for the muscle strength as well. This is dorsiflexion when the toes point toward the middle, dorsiflexion, and plantar flexion. Okay. The muscles are also examined for bulkiness, as we're comparing different muscles group from the left to the right size. For tone, normal degree of tension as well. For strength, I'm going to have the patient lie down to that side, please, and I am going to examine the strength of the lower extremity. Flex the knee while I'm trying to pull the leg forward in a lying position. Lay down, please. Flex the knee, relax your knee, flex the knee. So this is, try to push. Very nice, strong muscles. Also, coordination is very important to be examined, which is heel to shin. Also, the sensory system needs to also be evaluated for the lower extremity for pain and light touch, like we did in the upper extremity. I'm doing light touch, and I'm asking the patient if do you feel light touch?
Yes.
Or pain. I can gently press further down or pinch gently. Next will be also reflexes. We already elicited the reflexes of the upper extremities, and now we have to elicit reflexes of the lower extremities. Let's do the quadriceps or the knee jerk. Could you please sit up and dangle your feet down? The leg dangles, and I'm eliciting right below the knee, and that should elicit involuntary movement. And the last part of our examination is eliciting the reflex of Achilles tendon, which is an ankle jerk. I would strike the Achilles tendon directly. So I can hold it, and I can strike the Achilles tendon directly. And let's test the other side. And thank you very much for your time to watch the videos. We hope that you enjoyed it. Thank you for my patience as well. Thank you.